I'm very much excited. I'm very happy. Um, I hope all of you are safe during these COVID times. To be honest, I have utilized this time for my own personal growth. I have attended many webinars to update myself in the subject. I have taught students physics and anatomy related to radiology. And I'm very happy that I have this opportunity to guide students, young doctors, what to pursue after MBBS. Thank you for this opportunity, Texila. And let's move on. Now, this is the most important junction of our life. After MBBS, what to do now? Where to go? Where to settle? By when to settle? What subject to take? How to see myself after 5 years? Whether I want to be a family-oriented person or a career-oriented person or have work-life balance. I can relate with you all. So was I 15 years before. Now, before I get into our topic, let me tell you my story. I was in 8th class when I decided that I'll be a doctor, and to be specific, a pediatrician. Since then, I worked in first attempt for my MCET entrance, that is to get into MBBS. I got a rank in which I wouldn't get in a government college, but I could get in a private college. I was not interested in getting into private college for my own reasons. So I sat for 1 year, worked hard, gave myself, and got a single digit rank in my state, and then got into Usmania Medical College. Once into MBBS clinical postings and then internship rotations, whenever I entered into a pediatric ward, I was low. I was not able to tolerate that crying baby. I was not able to see those babies cry. I couldn't tolerate this cry. And I decided that I can't be a good pediatrician. It was not the choice of it was not the right choice for me. So then I was also clear that I don't want to do an emergency subject. I wanted to have a work-life balance. Being a female, I wanted to give both to my family and career. It was the same time during my internship that I got engaged, and my fiance was pursuing his surgery, master in surgery in Mumbai. We both discussed because we had only few months left to decide for my PG entrance. We had at the end when we discussed, I was neutral to all the subjects, but because I wanted to avoid emergencies, I felt that there were two good options for me, either MD Radiology or MS Ophthalmology. We also discussed with our family. My elder brother being doctor, he was able to tell me. I didn't have any support from my family because I was the first doctor to be in my family. Then with all the decisions, all the discussions we had, we decided that either MD Radiology or MS Ophthalmology. I had only 3 months left for my preparation. I personally felt that I want to be a radiologist. He being a surgeon and I being a radiologist, that would become a very good pair. And we have the option to settle in town, village, or district or in metro city. If in town, I can have my own private center. In city, I can have my private center or can get into a corporate hospital. So this was my plan. And I was like, MD Radiology, matlab I'll have the, I can read all the subjects because I was interested in everything. There was nothing that I was not interested in. So that was the way I was thinking in, those 3 months, I gave myself to PG entrance. Day and night, I was working hard, took my exam, got a rank for which I had an option to get an MD Radiology. And you know that to get a radiology seat, you have to really work hard. I had 3 counselings. You won't believe we had 3 counselings. And every counseling, I was so tensed whether I'd get MD Radiology. And that too, I wanted it only in a government medical college, not in a private. I had the option of every time I had 1 seat left over because there were only 3 seats. One was taken by the first ranker. There were 2 more seats. One was for the reservation. I was an OC candidate. So there was only 1 seat left over. I always I can just still feel that stress, how I was going through that time. But if suppose I don't get in medical college, government medical college, then I had to go for private medical college, MD Radiology. And I have, for my own reasons, I never wanted to get into it. If I don't get in either of them, then I had to choose between DMRD versus MS ophthalmology, which was really difficult. I wanted to be a radiologist. By then I fixed that I want to be radiologist. But for the rank I got, everybody would feel that I was taking a foolish decision. But still, I then thought that if I don't get MD radiology, then I'll go for DMRD, even if it is another college. It's okay. I'll take DNB if needed. I'll do something, but I want to pursue radiology. That was what I fixed. By his grace, in all the 3 counselings, I could get MD radiology in a government medical college. Now, the college I got, I had 2 options. One in city, that is in Hyderabad, and the other was in a district place, Warangal. I got it once in Warangal, once in Gandhi Medical College, again in Warangal. So the final counseling gave me MD radiology in Warangal, which is a district place. I was happy. I was going to pursue radiology. That is more than enough for me. In the place where I was studying, we had ultrasound, X-ray, CT. There was no MRI. And the staff was also good enough for the students. So I thought, let me take my basics here, learn all the basics in radiology, and then I can pursue it later. So after my MD radiology, I took 1 year fellowship in oncology. Then I worked 1 year as senior resident in Tata. Then because I wanted to be very good in academics, I took my FRCR exam. And with that, I could even get NUS Singapore MM radiology too. So this is the way I pursued my career. And every point in my life gave me one lesson to teach, one lesson. I decided that I want to be a doctor. I did not give up, even if I couldn't get in first attempt to enter into MBBS. I sat for a year. So what you pursue, please follow it. Follow your heart. Second thing, during your internship and medical postings itself, decide what you want to be. Know what are your likes, what are your dislikes. Come to a conclusion. Third thing, discuss with your family, especially with your spouse, and come to a conclusion. What are the subjects that suit you? Because you're not ready still for which place you're going to settle in. Then also, wherever you get, take the subject of your choice, and once you get the subject of your choice, your passion, you can work for it. Lifelong you can work, you can get the competence. So this is my story. Now let us move into our topic. Now, what are the career opportunities after MBBS? MD and MS, this is the most common chosen path by everyone. And I actually never knew that there were so many career opportunities after MBBS. Maybe because I was fixed. Either maybe earlier I wanted to be pediatrician, but once later on I decided to be MD radiology, I never thought about anything else. That might be the reason that I never thought about other opportunities. So MD and MS, with or without super specialty, this is the most common chosen path. The other being DNB, which is done in private medical college, national board examination. It's recognized by National Medical Council, and this is one of the best options if you cannot get into MD or MS. There are few diploma courses. Now many are abolished in India. There are but few courses by College of Physicians and Surgeons, either 2 years diploma, 3 years fellowships in few of the states in India. The other is Master of Medicine and Master of Surgery with Royal College training by Texila American University. They have 5 specializations, that is internal medicine, general surgery, radiology, pediatrics, and obstetric gynecology. Now, other options other than what we regularly know are the CMS, that is Combined Medical Services. You can write an UPSC exam. Through that, you can get into a permanent central government post, either in railways or municipal corporations as medical officer. There is good prestige and pride to that when somebody is working in a central government office. And there is chances that you can be into administrative posts also later on. Now coming to the other option, it is Masters in Business Administration. There's very much demand in this in private because of the many multi-specialty and corporate hospitals and many new pharma companies. There's a good demand for MBA in Health Administration. So is it for Masters in Health Administration. Both of them are 3 years course, and they are preferred by even insurance companies, pharma companies. Now, MBA is available in IIM, FMS Delhi, IPS Hyderabad, MGI Gurgaon. I can tell you that one of my senior, he was a radiologist in Hyderabad. After his radiology, he worked as a HOD in one of the units, and then he took his MBA in one of the good institutes, and then he became VP of the hospital, of a corporate hospital. So there is a very good scope even after MBBS, even after even a super speciality also. If you are interested in administration, it's a very good opportunity, and you also have good pay for it. Coming to MTech. MTech in Biomedical Engineering and Biological Sciences. It's provided by IIT. Here they deal with invention and development of machines and instruments. The only thing is you will not feel that clinician feel. You will be more like an engineer with a medical degree, but it is a very good opportunity. So is MMST, that is Master in Medical Science and Technology. This is also provided by IIT, which deals with healthcare imaging, biomaterials, implants, regenerative medicine, stem cells. Now we hear a lot about stem cells. So with biomaterials and implants. So these are one of the best branches. If you are okay pursuing non-clinical branches, these one are very good. Coming to clinical research. We know that in India, most of them, very few of them actually go into clinical research. Now there is a PhD degrees are provided by AIMS, PGI, NIMHANS. We can join ICMR or CCMP. Now ICMR, we hear a lot about it in this COVID times. They are trying to develop a vaccine. So there's lot in research in future. Coming to the other options, Masters in Public Health from Tata Institute of Social Sciences. One of my colleague who was my stretcher mate, he was dedicated. He wanted to do something for the country. He took Masters in Public Health Science in Mumbai. And then now he's connected with, he's working along with WHO. So that is a very good opportunity, those who are ready to be non-clinicians. Same like UPSC exam, there is State Public Service Commission, wherein you can become medical officer in state government hospitals. You can work as a primary health center, as a physician in primary health center. Now there are few options. One can just settle as an MBBS doctor in a place. There are places which are giving diploma in corporate hospitals, and even IMA is also providing few diplomas. Though they are not recognized by medical council, it is better to settle with some diploma degree, some specialization in a subject, rather than settling just like an MBBS doctor. If anyone is interested, they can even get into defense services, like become a medical officer in Army, Navy, Air Force. All these are good options. Administrative services. I know very few of us actually got into administrative services, but it is a good option if one is interested. The topper in our batch, I would say that best outgoing student from our batch, after he finished MBBS, he did MD General Medicine from AIMS. And to our surprise, he wrote civil services and got into IFS. He used to roam around, he would always be in international travel. Now he settled in Hyderabad. So that is also a very good opportunity. Now these are all the opportunities I was talking about in India. Now coming to abroad, if you are really planning to go to foreign countries, now this is the high time. By now you should have been already ready. If you are planning to go to US, then by now you must have written USMLE steps. If not, even now, if you are planning, it's best time. Better to go now after MBBS than to do a PG, go there and write again their exams take. I'll tell you example of my own dear friend. She did MD Radiology in Hyderabad. And then after that, she got married. Her husband was in US. So she went back to US. She did again radiology in US and then settled. It's now almost for me, it's 12 years and she just settled 2 years back. So if you want to save time, if you want to go abroad, this is the right time. So what we discussed till now is regular clinical path, that is MD, MS, DNB. If not, do a private practice as an MBBS, or take some diploma degrees. You can settle in government jobs like UPSC or State Service Public Commission. If you want to go abroad, decide now. If you are okay with non-clinical, you don't want to be recognized as a clinician, you can even take MTech and MSc from IIT and get into engineering. And MBA and Masters of Health Administration, very much in demand. You can become administrative officer in corporate hospitals or get into pharma companies. You can go into research, and then if you are interested, defense and administrative services. So these are all the career options after MBBS. Now, if you want to pursue MD, MS or DNB, let's discuss. Now, what are the branches available? Now, clinical and the preclinical branches. Clinical branches, there are these non-surgical branches, that is MD medicine, pediatrics, pulmonology, psychiatry, and radiology. There are a few more like transfusion medicine and emergency medicine. And surgical branches like MS, general surgery, obstetric gynecology, orthopedics, ophthal, ENT. Coming to ophthal, ENT, these are end branches. The other branches, preclinicals, these are all those subjects which we do during our first, second, third years, except for the ENT and ophthal. So we have anatomy, physiology, biochemistry, pharmacology, pathology, microbiology, forensic medicine, and community medicine. Now, before we decide specialty, how should we decide a specialty? First, know your passion, follow your heart. Like I had an option. I had my passion of being a doctor first. So if you want to be a doctor, just get into MBBS. Now, during your MBBS itself, during your clinical rotations, you must be knowing what you are really desiring to be. Follow your heart. With those rotations and internship experience, you would know what to include, what to exclude. If you're not still sure, it's okay to work under those. If you can, with the experience you get in rotations and internships, come to just 2 or 3 options which would suit you. And if you're not clear in that what to go, you can work in that department for few weeks or months and then know about the pros and cons and then take it. Now, if you don't know what is your passion, at least know what you dislike. That is using exclusion criteria, the way we do it in our entrance exam, if you don't know the answer. Okay. So, are you good at reading books? Are you ready to take stressful life? Are you okay with crying kids? I was not okay with crying kids, so I just gave up pediatrics. Are you okay with cutting and surgery, suturing, blood fill? Then surgical branch is a good one for you. If you're ready for reading books, then general medicine or medical related subjects are good for you. So know what you like. If you don't know what you like, at least know what you dislike and use this exclusion criteria. So the most important thing is you have to know whether you want to be a surgical person or a non-surgical person. You have physician's brain or surgeon's hand. Now that is the most important thing. Now evaluate every variable. Patient interaction. This is one of the most important thing. If you always want to have that patient feeling, patient interaction, then you have to go for the clinical subjects. If you don't want to have patient interaction, then preclinicals or maybe radiology, where you have minimum interaction with patients, they are the good options for you. Time. Suppose you want to settle in next 3 to 4 years, then go for terminal branches. You're okay. You have a lot of time. You can take 6 to 7 years, and you want to pursue super specialization, then go for it. Suppose a person is from middle class family, he may not afford 5 to 6 years, then he has to settle. He may have to take a terminal branch. Now, coming to money, yes, money is an important factor, but not the factor. It's the money time ratio that is most important. Suppose there is a person A who is working for 12 to 13 hours a day and earning some 4 lakhs. And there's another person who is working for 8 hours a day and earning 3 lakhs. I would say the person B is having a much better life with money time ratio compared to the person who is working for 12 to 13 hours. So that money time ratio is more important than the money itself. Do you want to have your own private setup or you want to work in a corporate? If you want to have your private practice, you want to have your own private hospital, then are you ready to deal with non-medical related things? Are you ready to deal with government officials, paramedical staff, class 4 workers? Are you good at managing them? Even if you are not good at managing them, you can hire a person, but then be prepared for all those things. No, I don't want to have an hectic life. I want to work under corporate. I'll show my skills there, but I don't want to take a stress of other things, managing a hospital. Then corporate is a good option for you. And to work in a corporate, then you have to be in a district or a metro city. So that depends on where you want to settle to. Now, India versus abroad, we discussed. If you want to be in India, you have too many options. And of that, there are many. Now, if you want to go abroad, this is high time. You have to choose by now. Now, you want to have a peaceful life, then go for preclinicals or the clinical subjects where there are no emergencies. Always have work-life balance, have comfortable hours, flexible shifts. Then choose subjects like radiology, dermatology, psychiatry. These are good subjects wherein you can progress. So these are many factors. Actually, there are too many participants, too many variables. We have to see all the variables. Now, choosing a branch is just like a marriage. Yes, whether it's a love marriage where you are in love with the subject you want to get into, or you got a subject which it's like an arranged marriage. You got a subject in your entrance and you are living with it. In either way, you have to learn to love and live with it. Now, there are only few circumstances or few instances where one would divorce or leave the subject of his subject which he got into, has to go through all the process and the pain of preparing for the PG entrance, then give the entrance and then counseling, so much of stress, and with that uncertainty whether you will get the subject of your choice or not. So before choosing a branch, you should actually think a lot. You should discuss with your, if you are engaged, you should discuss it with your fiance or the spouse, with your own family, with with your seniors. Know the pros and cons of the subject and then choose it, because once you choose, learn to live with it. Now, what are the other factors? As we discussed, duration of training. Now, for MS and MD, it would take 3 years. But if you want to pursue super specialization, it's going to add 3 more years. That is almost 6 years. Are you ready to spend so much of time? Are you ready to go through the entrances, the stress of it? Are you ready to prepare? Give yourself. And then there are some places where you have government service bond. You have to work for 1 or 2 years. And after that also, there are few who want to do subspecialization, which may take few more years. So before you choose a subject, before you do get into it, always think of the time. By when will you settle? It is always better to have a stable income or settle in your 30s. So think before you take a decision. Coming to branch versus college. Yes, this is one of the most important things. Definitely it is the branch into which you want to get into, because that is the one with which you will be living your life. In my case, I wanted MD Radiology. I wanted that branch, even if it was in a government, even in a college. I was lucky to get it in a government medical college, but even if it is in a district place, it's okay. Even if there is less exposure, it is okay. Once you are passionate about your branch, you can work for it after you get your degree. You can get into subspecialization, or you can work in a place with good workload, volume load. So always choose the branch and pursue that. Coming to income potential, now it has many variables. It depends on the place of settlement. Now, if one wants to settle in a town, now, and also have his own private practice, now there is no limit to what he can earn, with the stress associated with that, and the expenditure would be less. If you want to settle in a metro city, then there are too many things you have to think about. If you want to get into a corporate hospital, then there is a ceiling to what you earn. So there are many factors that would decide your income potential. There are some subjects like radiology, anesthesiology, intensive care units, where you have a high starting salary, but then you come to a ceiling. There's a plateau to it. There are some branches which will give you very less in the beginning, but after a few years, there is no limit to what you earn. Like surgeons, like super specialty branches, DM branches. To begin with, it will be slow. It will start slowly, but once it will be a curve with slope, not a curve with a plateau. Now let us know about the branches. Coming to MD General Medicine. Now, MD General Medicine, if you know that you have a physician's brain, you are ready to study for years, you want to settle, wherever you want to settle, you can settle with MD General Medicine. A village, town, city, anywhere. Very good income, there is very good recognition in society, but the cons would be you will have a hectic life and there will be emergencies. So be prepared for it. Now, if you are interested, there are many options in super specialty. To be specific, like cardiology, neurology. If you want, like once you get into general medicine and you feel that you are okay with managing emergencies, then cardiology and neurology are the best subjects for you. But then you later realize that you want to have a little cool life. You don't want to deal with too much of emergencies. Then there are a few more branches, like gastroenterology would have plus or minus, but nephrology, endocrinology, rheumatology, medical oncology, pulmonary medicine, medical genetics, immunology, hepatology. So many options. So if you don't want to settle just as an MD general medicine, you have an option to do super specialty. And in that also, if you are okay with emergency subjects like cardiology, neurology, you want to have a still cool life, you don't want to take too many emergencies, then also there are many more options. So if you are passionate about medicine, you can take it depending on your choice. Now coming to MS general surgery. Same is the case with general surgery. The only thing is you should have the surgeon skills. Can settle anywhere, you can have good income, yes, recognition in society. Are baba, surgeon hai bolke. It will be there. You'll have hectic life, there will be many emergencies, but you are prepared for it, right? You can, if you want to settle in metro cities, you can go for super specialty. There are many options for MCH, but then be prepared for those 6 years to settle in case you get everything in first attempt. Now, there are branches which deal with emergencies like neurosurgery, surgical gastroenterology, urology, plastic surgery, and trauma. But now you get into general surgery and you feel that I cannot go through that emergencies, I don't want to have an hectic life. Then there are few more options like CVTS surgery, surgical oncology, very good option, upcoming, it's into like, it's in mode. Head and neck surgery with oncology, breast surgery, very good for even female general surgeons. Anybody can take it, but very good option for females who have pursued their career in general surgery. Now they can be breast surgeon or they can be just gynec onco surgeon. So pediatric surgery, these are all good options where you are a surgeon, but with not much of emergencies. You can plan your surgeries accordingly. Coming to MS Ortho, now this is like a surgeon, but with a terminal branch. Most of the time it's the terminal branch. You can settle at any place with good income, with good recognition in society, good work-life balance. There will be emergencies, but comparatively it will be less compared to general surgery or general medicine. If you want to pursue, there are subspecialties. Now you will hear in metro cities, there's a knee arthroscopic surgeon, shoulder arthroscopic surgeon, hip arthroscopic surgeon. There are people who are just specialized in ankle, only wrist surgeons, spine surgeon. So there are too many options. You can settle just like an MS orthopedician, or you can go into subspecialization and pursue that with very good life, not much of emergencies, with good income and good recognition. Now coming to obs gynec, I know most of the females would choose this subject. This is a passionate subject for many of them because they're not sure about where they are going to settle by then. So with this degree, they can settle in any place, whether it's village, town, city, anywhere. You can have your own private practice, or you can get into a corporate sector if you don't want to have your own private practice. Very good income, very good recognition in society, but associated with it is very hectic life. Too many emergencies, deliveries, C-sections. So you have to be prepared for that. Are you okay with that? So you have to see whether we'll be able to have that good work-life balance. So before you take obs gynec, you should know all the advantages and disadvantages. But if you are passionate about it, then there's all these things do not make any difference. Suppose you get into obs gynec and then you feel that you are not able to handle that emergencies, that hectic life, then there are few more options for you. You can become a fertility specialist, a fetal medicine specialist, or a gynec onco. We have a gynecologist who has done fetal medicine specialist, and she is one of the leading fetal medicine specialists in Hyderabad. And she has an upper hand because she knows how to manage also. She's not just like a radiologist who is seeing the abnormality and telling. She also knows how to manage that patient, how to manage that baby, whether to continue the pregnancy or not to continue the pregnancy. So fetal medicine specialist or a fertility specialist, when there are not much of, there's actually no emergencies, you can plan all the things according to your schedule. So this would be a very good option. Now coming to MD Pediatrics, it's just like general medicine, but you are dealing with the kids. You can settle anywhere, you can get into private practice, corporate practice, you can have actually multiple attachments. You can attach yourself to multiple obstetric gynecology hospitals, you can take care of the neonates and the infants there. Very good income, very good life, recognition in society. Now you know, almost everybody will go through this process. Their kids will have some or the other issues in their life, and they'll go to a pediatrician. So too much of actually good recognition in society, and you should have liking for the kids. You have emergencies, but not as much as in other branches. If you want, you can still go for super specialty in neonatology or take some fellowships also. So with this Pediatrics degree, you can settle anywhere actually. Coming to the end specialties like MS ophthalmology, it's an end branch. You can see this, you can settle in town, city, anywhere. Good average to good income. And if you become a very good ophthalmologist, there is no limit to what you earn. You'll have the satisfaction, that surgical satisfaction, not much of emergencies, maybe for except for foreign body or trauma related to eye, hardly there would be any emergencies. Very good family life. So it is one of the branches which is chosen by females. It's not that males cannot take it. I'm just telling it's one of the branches as I kept it as my second option. Then you can have your own private practice or get into corporate. If you're getting into private practice and you are a good surgeon, then just remember that you'll have a good investment to begin with. You can also pursue fellowships, like you can be a corneal surgeon, retinal surgeon, LASIK, glaucoma specialist. So if you want, you can just settle like an MS ophthalmologist. You want to settle in a metro city, then you can go for these fellowships. Coming to MS ENT. Now, this is just like ophthalmology is an end branch. You can settle in any town, city, average to good income, good surgical satisfaction, not much of emergencies, so good family life. So those who want to be a surgeon with not much of emergencies, opthal and ENT are one of the good options. There are fellowships available in this, like few people would prefer being a skull-based surgeon or maybe just only a nasopharyngeal surgeon or a laryngeal surgeon. So there are subspecialties even in ENT. Coming to the radiology, my subject. Now I think I can go on and on in this. Like you can settle in any place. That was my condition. I didn't know. My husband is from a town. I was from a town place. So we were not sure by then when we were getting married whether we will settle in a town, city or metro city. So I felt that MD radiology is good. I can settle anywhere with that. And to be true, your doctor's doctor. A clinician would just tell you, will suspect by seeing the patient, he will think of 2 to 3 diagnoses. Now it is you, the radiologist, who will give him the right diagnosis and help him treat the patient. Though you are behind the curtain, that the satisfaction of guiding and helping the patient get the right treatment is different. Very good income to begin with. It's a cool branch, very good. You can have good family life. Like I'm working only for 8 hours a day and I'm able to balance both my family and my professional life. Very good subject for females. And if you don't, you have online resources for learning. It's there for all the subjects, but for radiology, I think most of them who are working in district places where where there is not much of MRI teaching and all, they are learning from online resources. If you are at home and for some reasons you can't go to work, you can do teleradiology. One of my friend, she is from Hyderabad. She has done her PG from PGI Chandigarh because she has to take care of her kids. She's sitting at home and doing teleradiology. She's very good at CT and MRI. And so she's doing that. So that is an option available. You can attach to multiple hospitals. Like you can work for few hours in multiple hospitals. Now this is an end branch. You can just settle like a radiologist. No, you want to do fellowships. There are multiple fellowships. You can be a you can get into radiology or body imaging, fetal medicine, where you don't want to deal with much of emergencies. So if you are like, you will not have much of interaction with the patients. And if you want to do super specialization, then you can go for neuroradiology or intervention radiology. Intervention radiology is just like any other clinical subject. You will have your own patients. Now coming to the cons, not much of patient interaction, though we have it during our ultrasound postings or when we are doing procedures, diagnostic or some therapeutic procedures, but not much of patient interaction. Extensive syllabus, we have to read everything from head to toe. And not only that, we should know X-rays, ultrasound, CT, MRI, and all the upcoming things. So we have to keep yourself updated with upcoming technologies. So be ready for being an ever learner. If you want to have your own practice, you'll have a good investment. Maybe if you're thinking of only ultrasound, maybe it will be in lakhs. But if you want to have a CT and MRI, it will be in crores. So you have to think about that. If you think you don't want to have your own private practice, then you can just enter into a corporate then, but there will be a ceiling, you will have a plateau. And being a doctor who is behind the scene, there's not much of recognition in society. Coming to artificial intelligence, we don't know how it is going to be in future. It will just aid the radiologist in diagnosis or it will partly take over. We don't know. We have to just wait and see. Coming to MD Dermatology, it is one of the best branches. It's an end branch. I know most of the top rankers would prefer either radiology, dermatology, if they want to have a good family life, because they can settle in any place, town, city, metro, anywhere. There are no emergencies, literally no emergencies in dermatology, maybe except for some reaction that would need immediate treatment. And if you want, you can further go for specialization into cosmetology, hair transplantation. And now I'll say that cosmetology and hair transplantation is in demand. It's in boom. There is no limit to what you can earn with that. So if you can take, if you wish, if you are interested, you can take dermatology. And if you're not happy just practicing the regular dermat, you can also go for cosmetology and hair transplantation. Coming to MD Psychiatry, take it only if you have strong inclination for it. You have to be a good listener. You should have that patience. Only then take the subject. And then, though because of this hectic family life, hectic work life, the way everyone is going through now, there's increase in psychological problems. So there is increase in demand for this subject. So it is a good option, provided you have good interest in that. You can have your own private practice or get into a corporate. No emergencies, so good work-life balance, average income, or it can be good based upon the way you develop your clientele. Now coming to other branches, these are the ones which we discussed, which are routinely we all know about it. Now there are other branches like MD Emergency Medicine. Now with this COVID, you know how much there is demand in emergency medicine. Once the patient enters into casualty, now we no more call it as casualty, we call it emergency medicine unit. So those are the doctors who are first-hand persons, who are standing there, who are the actual warriors there. So MD medicine is a good option. But then, just like general medicine, you will know that you should know that you are dealing with emergencies, so you will have rotations, night calls. Be prepared for it. The other option is MD transfusion medicine. Actually, last few years, I didn't even know that there is a transfusion medicine. One of my friends, Bhabi, has just passed out from transfusion medicine from KEM hospital. Now, this is available in few of the hospitals. It's a good branch. It's just like you can have work-life balance. So, and because of this COVID, I would say there is much demand in this. Many patients are requiring plasmapheresis. So these are the people who are dealing with it. So these are good branches. Now coming to the preclinicals, MD Pharmacology. All these preclinicals, first thing you have to understand is there is no patient interaction. Though most of the options that will be available will be teaching hospitals or having a diagnostic center. Now coming to pharmacology, there is a peaceful life. You can get into teaching hospitals now, but because of saturation, we don't know how good are the opportunities. Average income, but if you are interested to travel, then you can get into pharma companies. And once into pharma companies, then there is no limit. You can reach to whatever extent you want. You can have international travel. You will have good income, but then you should be ready for travel and getting into the company. Coming to MD Pathology, one of the most preferred branches, those who are ready for no patient interaction. You'll have a peaceful life. You can have your own practice, just have a diagnostic laboratory with good income. If not, you can just get into a corporate hospital. Only thing is there will be a plateau to what you earn. Because you are behind the scene doctor, there's not much of recognition. Now you have multiple subspecialties even in MD Pathology. You can become a neuropathologist. You can be a gastropathologist, oncopathologist. Now these subspecializations, again, they are in demand in corporate hospitals. So pathology is one of the good branches if one want to have a good family life. Coming to MD Community Medicine. This is also one of the good options. Now it can be preclinical or it can become a partly clinical branch also. Most of the options are available will be getting into a medical college as a teaching staff. Average income, but if you are interested into research, then you can just get into WHO and you can get, as I told about my friend who did his master's in public health service, and then now he is working along with WHO. Now, the non-clinical branches like MD Physiology, Biochemistry, Micro, and Anatomy. Now, all these others are MD, and coming to MS Anatomy. All these, You have options basically in PG as a teaching faculty. You can get into either a medical college or a private college. Now, in between, there was a very much boom for these branches when there were too many private medical colleges coming up. Now, but again, because of the stabilization, we have to see whether there is availability for these posts. For biochemistry and microbiology, there is an option for starting their own private lab. So if you are really inclined to be a clinician, then I would say that even if you have to give one more year, give your year and get into clinical branches. But then if you are neutral to anything, maybe you can think of. Coming to MD/MS versus DNB. Now, many of them have this query, is DNB equal to MD and MS? Yes, right now, at this present time, they have MD/MS is almost equal to DNB is almost equal to MD/MS. Only difference would be like MD/MS you will be doing in a government hospital where there is good exposure, hands-on exposure, so your experience will be good. Coming to DNB, it is you take it in a private hospital. It's easy to enter, but they say that it is difficult to pass because the passing percentage is little less as compared to MS and MD. Coming to hands-on experience in surgical branches, it is going to be definitely less in DNB. But then if you are interested in surgery, you want to pursue it and there is no other option, you don't want to waste your time preparing again, then go for DNB surgery. But then be prepared that after your DNB surgery, you will go ahead, work in a place where there's a lot of volume load, hands-on experience, or you'll go for super speciality. So then it would not make a difference. But for the surgical branches, I would say that MD and DNB does not make any difference. Yes, one thing that may be a difference would be when if you want to get into a teaching hospital or into government setup, where they would prefer an MD/MS over DNB. I think that is the only place there will be some difference, but otherwise if you want to have your own practice or get into a corporate, it doesn't make a difference as far as I know. Now, the advantage of the DNBs will be exposure to the latest equipment and practices in corporate hospital. I can give example of my own hospital. It's a radiology department is fully equipped. We have 1.5 Tesla MR, 3 Tesla MR. We have an intra-op MRI. And also we have intervention radiology unit with us with an intervention radiologist specialist. We have like MR elastography, ultrasound elastography. So there are many modalities with this. And we have now digital mammography and tomosynthesis. So the DNB residents who are working in our hospital, they have this exposure to all these new equipments. So that is the advantage of DNB into getting into a medicine or radiology branches. So also even our neurosurgery residents, because of 3T MRI and also neuro navigation, they are exposed to all these newer technologies. So that is one advantage of doing a DNB from a good private hospital. Future trends, it's difficult to predict. Like when I took my MD radiology, that was the one of the most important or the branch that was chosen by top rankers. Now it keeps changing. Now people prefer nuclear medicine, dermatology. I think one of the most chosen option, dermatology. Other options, if somebody wants to have a good family life, nuclear medicine, radiation oncology. These are all very good options. So future trends change. We have to keep ourselves updated with the changing trends. Artificial intelligence, telemedicine, robotics. These are the things that will change the practice of medicine in future. Now, this is a slide I have taken from internet. I just liked it. So if one is pursuing post-graduation, you just see whether you want non-clinical branch or you want to get into clinical branch. That is, you want to be in touch with the patients. Now, if you get into clinical branch, you have surgeon's hand or you have physician's brain. Get into medicine if you have that physician's brain and not inclined towards surgery. You want to have patient interaction, there are many options for you like medicine, pediatrics, dermatology, pulmonary medicine, psychiatry. But if you are not interested or you want to have minimum patient interaction, radiology is one of the best branches. Surgery, yes, you will have to have patient interaction. So every specialist has an important role in patient care, whether it is general physician, dermatologist, pathologist, surgeon, radiologist, microbiologist. Every specialist has an important role in patient care. There is no branch that is good or bad. it is our choice. What is our passion that we have to go for. Before you choose a subject of your choice, just speak to your seniors, speak with the existing practitioners of that particular branch, know what are the pros, what are the cons, because things change with time. So based on that, you have to decide. Seek and find your passion. Now, because most of our waking hours will be our at workplace, almost 8 to 10 hours, most of us would be, that too in our waking hours, will be in our hospitals. So make sure you go for that subject in which you are interested, because when you are happy at work, that is the happiness in life. So seek what you like. Passion can always develop competence, but the other way is not true always. If you are passionate, you will work for it. You will go for subspecialization or super specialization, or give a few more years to develop that competency in you. Always. So once you know what is your subject, your choice, then have a rough plan of settlement. Like, where do you want to settle? By when you want to settle? Want to have a private practice or a corporate practice? So have a rough plan for settlement. And also always have a backup plan. Like in my case, I just thought if I get MD radiology is fine, but that always I kept my second option as MS ophthalmology. Provided I do not get radiology, I kept my option open as MS ophthalmology. So always have a backup plan. Now, most important thing is quality of life, because your workplace can find a replacement for you, but not your family. So make sure before you choose your subject or get into it, is your family will get enough of you? Because even a little less with peace is far greater than little more with no peace. That is standard of life. Or do you want to have quality of life? I believe standard of life without quality of life is no life at all. Now, this is one principle called Ikigai principle. It's a Japanese concept where, according to them, it says that like what you love and what you are good at, make it your passion. What you are good at and what you can be paid for, make it your profession. Like, I'm good at finding out things, so I have taken radiology. Now I'll be paid for it. So it has become my profession. Like passion, somebody would love to paint. So if you love to paint, it is your passion. But if you make that passion and if you can be paid for it, it will become your profession. What the world needs and what you can be paid for will be your vocation. And what you love, what the world needs, if you go, it is your mission. So what you love, what you are good at, what you can be paid for, and what the world needs. If you have this thing in your mind, you have this Ikigai. That is your Swadharma. This is my family. This is my younger one, Neo. Here I'm studying. I'm trying to update myself and enjoying my life, both family life and spiritual life. Now, most of you are in this stage of life. What we were, what we are, and what we have been has no bearing on what we can be. Most of you are in this stage of life. I know you, most of you or all of you will make a career wherein you'll come out with flying colors. But I not only want you to come out with flying colors, but also make yourself not only the best in, you become the leader of the subject you get into. So you aspire to become leaders of the future. Thank you. Keep learning, keep growing.
It was indeed a very informative session, Dr. Sapna. Thank you for so much. Before we could wind up the session, we have few questions. Before answering up the questions, I would request the participants to take up the poll. And we are now moving to the questions. We have a question, ma'am. The question is, ma'am, want to know more about career scopes in abroad. Please give a detailed explanation.
To be frank, I never thought of going abroad, because I always wanted to settle in India. So I think I'm not the right person to tell you what is the scope in abroad. Yes, many of my friends, actually I would say 50% of my friends, like they are in abroad, they have pursued their USMLE and most of them are settled in US. Now, but with changing times, changing trends, it will be difficult for me to tell you what exactly you will have. You will have to speak to the persons who are who have really tried for those courses who have settled just now in abroad. Maybe they will be the right persons. Honestly, I don't have the idea about what is the scope in abroad.
Yes, ma'am. Yeah. And we have another question. Ma'am, I have a medicine's brain, but more inclined to surgery. What should I choose?
Personally, if you ask me, if I am really good, if my skills are good, I will go for surgery, because a surgeon with a physician's brain will be an excellent surgeon. If you are really good at surgical skills, go for it, because there is no limit to what you can do in your life. And if you have that physician's brain, you will be an excellent person, because you know how to diagnose. You will not delay the diagnosis. You will be the sharp. You will take immediate action, and a surgeon has to be so. So if you ask me, if you have good surgical skills, go for it, because physician's brain is also needed in surgeon skill.
Thank you, ma'am. We also have a question from Dr. Akbar. Any info about medical coding for MBBS doctors?
Sorry, I do not have any idea about that.
Okay, ma'am. We have one more question from Ishwari. Ma'am, can you throw some light on PLAB exams and MRCP or FRCP?
Sorry, as I said, I have never worked for those exams, so I cannot guide you. I know most of it, what happens in our country, what are the options, and coming to what are the branches that are good. And even if you want, I can tell you about FRCR, but PLAB exams and MRCP, I'll not be able to.
Okay, ma'am. Okay. There is one more question. Ma'am, can you tell us about some degrees that are in India and recognized by other countries?
Now, degrees that are in India and recognized
by other countries.
Now, see, whichever degree you take in India, but if you have to go to other countries like Australia, you will have to appear to their American board exam, Australian board exam. If you want to go to this Middle East countries, they will have all this radiology. If you want to go to Middle East countries, most of the degrees that are there in India will work there. If you also have a FRCR or an MRCP related degree, then you will have an upper hand. But all these Middle East countries, you can get into that. But you will have to go through an entrance exam, and based on that, you will get into that. But if you have to go to USML, if you have to go to US, then you will have to take USMLE. It is very difficult. It's difficult to get even into Indian degree.
Thank you, ma'am. We also have your appreciations. They say the session was wonderful and really helpful. We also have an appreciation from Aishwarya.
Thank you.
Ishwari, I'm sorry. Very clear and sorted view of all the branches and the pros and cons. Thank you, ma'am.
Thank you.
I'm sure the participants would have got great insights. Thank you so much, ma'am, for sharing your time and knowledge with us. Thank you.
Thank you so much. Thanks for the opportunity. Okay, bye.
Bye, ma'am. I would also like to thank the participants for joining in. Thank you so much.